The University of Kentucky has reached a major milestone that signals a bright future for health education in the state. On August 28, 2025, UK leaders, state officials, and Turner Construction gathered to celebrate the ceremonial topping out of the new Michael D. Rankin, MD, Health Education Building, a moment that marks the placement of the final steel beam atop this impressive structure. But here's where it gets interesting. This isn't just about construction progress. It's a powerful symbol of Kentucky's commitment to advancing healthcare education and addressing critical workforce shortages. Located at the crossroads of University and Huguelit Drives in Lexington, the 509,000 square foot facility broke ground in October 2023. This building will serve as a hub for multiple health-related colleges at UK, including medicine, public health, health sciences, and nursing, as well as the Center for Interprofessional and Community Health Education. Before the beam was set in place, alumni, faculty, staff, and students from these colleges had the unique opportunity to sign it, leaving their mark on a project that will shape the future of healthcare in Kentucky. UK President Eli Capilouto captured the significance perfectly. This milestone is about more than just steel and concrete. It embodies our steadfast dedication to improving health across Kentucky. This building stands as a beacon of collaboration and progress, where students from diverse disciplines will unite to learn, innovate, and develop solutions that strengthen healthcare for every community in our Commonwealth. The project's scale and ambition were made possible by the 2022 Kentucky General Assembly, which approved $430 million in funding, including $250 million in state bonds. The UK Board of Trustees gave the green light for construction in June 2023. Senate President Robert Stivers emphasized the importance of this investment, stating, "Allocating $430 million with $250 million in bonds is a clear vote of confidence in Kentucky's future. This facility will train thousands of healthcare professionals annually, directly tackling shortages that impact nearly every county. It's a long-term strategy to enhance healthcare access, boost community well-being, and fuel economic growth for decades." One of the most pressing challenges Kentucky faces is the shortage of healthcare providers, ranging from doctors and nurses to physical therapists, speech pathologists, and public health officials. This shortage is especially severe in rural areas, where access to care is often limited. The new Rankin Health Education Building is designed to be a key part of the solution, expanding UK's capacity to train up to 1,200 additional students. This means more skilled professionals ready to improve health outcomes across the state. The building's design dedicates 77% of its space to academic, shared, and collaborative areas for students and faculty. This includes 25% for classrooms and learning labs and 34% for simulation and hands-on experiential learning, critical for preparing students to face real-world healthcare challenges. Here's a closer look at how the new facility will enable growth across UK's health colleges. The College of Medicine will increase its Lexington medical student enrollment from about 138 to 200 per year, a 44% jump. This expansion will bring the total number of medical students across all UK campuses to over 1,000, making it one of the largest medical schools nationwide. The College of Nursing will significantly boost enrollment in both its traditional Bachelor of Science in Nursing (BSN) and advanced BSN programs, directly addressing the statewide nursing shortage. The College of Health Sciences will grow its student body by 30%, accommodating more than 460 students across 10 professional programs. These include physical therapy, physician assistant studies, communication sciences and disorders, athletic training, clinical nutrition, medical laboratory science, and a PhD program in rehabilitation and health sciences, along with new academic offerings. The College of Public Health plans to expand enrollment by 50%, focusing on undergraduate pathways that prepare future public health and healthcare professionals. This growth is strategically aimed at meeting critical workforce demands and providing students with enhanced career opportunities. The Center for Interprofessional and Community Health Education will increase its impact by reaching 50% more students annually, equipping them to deliver high-quality, team-based care. Beyond its impressive size and capacity, the Rankin Health Education Building was thoughtfully designed to foster collaboration and flexibility. Shared hallways, classrooms, and labs will encourage the exchange of ideas and perspectives among students and faculty from different disciplines. This environment is expected to spark innovative research, new treatment methods, and the adoption of evidence-based practices that improve patient care. For example, students in medicine, health sciences, and nursing will benefit from simulated patient experiences through the Standardized Patient Program, which mimics real-life clinical scenarios. David Opalka, Vice President and Construction Executive for Turner Construction Company, reflected on the significance of the topping out ceremony. This moment is more than a construction milestone. It's a celebration of teamwork, purpose, and pride. Every beam and slab was placed with intention, creating spaces designed not only for aesthetic appeal, but for functionality, adaptability, and the future of healthcare education in Kentucky. We thank our entire project team, design partners, and tradespeople whose dedication and craftsmanship have brought this vision to life. Together, we've built more than a building. We've laid the foundation for breakthroughs and learning that will shape tomorrow. As Kentucky's flagship land-grant university, the University of Kentucky is dedicated to advancing the Commonwealth by preparing the next generation of leaders. Students are at the heart of everything UK does, and the institution transforms lives through education, research, creative work, service, and healthcare. UK prides itself on being a catalyst for innovation and healing, a place where new ideas flourish. This is made possible by a vibrant community of visionaries, disruptors, and pioneers who contribute to 200 academic programs, a $476.5 million research and development enterprise, and a world-class medical center, all located on a single campus. But here's the question that might spark debate. With such a massive investment and expansion, how will UK ensure that the increased number of graduates actually stay and serve in Kentucky's underserved rural areas? Is expanding enrollment enough, or should there be stronger incentives to retain healthcare professionals where they are needed most? We'd love to hear your thoughts. Do you agree that this building will solve Kentucky's healthcare workforce crisis, or is there more to the story? Share your opinions in the comments below.